Hello, my name is Dr. Dewan S. Raja. Today I will discuss about the pharmacology of the phenytoin. The phenytoin is an anti-epileptic drug for many decades. It was previously called diphenylhydantoin. What is the mode of action of phenytoin? Phenytoin blocks voltage-gated sodium channels. It increases the release of gamma aminobutyric acid, and it decreases the secretion of glutamate. GABA is an inhibitory neurotransmitter. Glutamate is an excitatory neurotransmitter. It suppresses seizures, used as an initial therapy, particularly in adults. Fosphenytoin, market name is Ceribix, is a water-soluble prodrug from of the phenytoin that is used parenterally by intramuscular or intravenous injection. So it is a prodrug form of phenytoin, the fosphenytoin. Fosphenytoin can be administered rapidly without precipitation, as happened in phenytoin during intramuscular injection, and with minimal vascular erosion. Again, sodium phenytoin may cause vascular erosion, but fosphenytoin will cause very minimum vascular erosion. Fosphenytoin is the drug of choice for status epilepticus. Status epilepticus is a life-threatening condition of continuous convulsion and that need very quick treatment that is done by fosphenytoin. This is one of the most important drugs for status epilepticus. In status epilepticus, we also give diazepam, but this is the drug of choice for anticonvulsant, along with other like that of diazepam. Therapeutic uses: phenytoin is the preferred drug for tonic-clonic grand mal epilepsy, simple and complex partial, that is focal epilepsy, and status epilepticus. You have to remember that phenytoin is not useful for absence seizure. So it is not a drug of choice for efficacy is not also good for absence seizure. Phenytoin is a type 1B antiarrhythmic drug. Some pharmacology books use this as type 1B antiarrhythmic drug because of its use in case of digitalis induced arrhythmia. Phenytoin is used to reverse digitalis induced arrhythmia. Phenytoin has some value in migraine management. Phenytoin is the old anti-epileptic drug. Like other anti-epileptic drugs, phenytoin should be withdrawn gradually, and its dose should be adjusted gradually depending on the blood level, the plasma level of the drug, and its withdrawal should be gradual, otherwise there may be chance of convulsion, reactive convulsion. Absorption and fate of phenytoin. Oral absorption is slow, but once absorbed, distributed rapidly, and the concentration in the brain is high. Become high. The drug is mostly bound to plasma protein, more than 90%. Less than 5% is excreted unchanged in the urine. It is metabolized by the hepatic cytochrome P450 system At low doses, half-life is 24 hours. As the dose increases, the hydroxylation system becomes saturated, and a small increase in the dose of phenytoin causes a large increase in plasma concentration of the drug. You have to remember that there is genetic variation in the metabolism of phenytoin. Okay, what are the adverse effects of phenytoin? It may cause nystagma. What is nystagma? Involuntary oscillatory movement of the eyeball, diplopia. There is double vision, sedation, confusion, hallucination. What is hallucination? There is a sensory perception. Okay, so there is a false sensory perception. Gingival hyperplasia. Okay, so we have also gingival hyperplasia. Okay, coarsening, hirsutism, facial coarsening. Face will be coarse, hirsutism. That is, the patient will develop excessive hair growth in unsightly places, especially it will be very much disturbing to the females. Megaloblastic anemia due to vitamin B12 deficiency, because it competes with the factor which help in the vitamin B12 absorption. So phenytoin may cause megaloblastic anemia, that is vitamin B12 deficiency anemia. Peripheral neuropathy, osteoporosis, induction of hepatic drug metabolism, congenital birth defect. It may also cause vitamin D deficiency that may lead to osteomalacia. So another adverse effect is congenital birth defect. We call it fetal Phenytoin syndrome. Okay. So what are the features of fetal Phenytoin syndrome? Include cleft lip, cleft palate, microcephaly, congenital heart defect, retarded growth, and mental retardation. Okay. Okay. So decreased efficacy of oral contraceptive and other hormonal contraceptive is also possible, and so the efficacy will be disturbed by simultaneous intake of phenytoin. Phenytoin with low therapeutic index, steep dose response curve requires careful monitoring to avoid toxicity of phenytoin. Okay, but remember that phenytoin decreases the release of antidiuretic hormone and also insulin from the beta cell of the pancreas, antidiuretic hormone released from the hypothalamus and posterior pituitary. There is a storage place of antidiuretic hormone. So phenytoin decreases the release of antidiuretic hormone. So it may cause hyperglycemia. Drug interaction of phenytoin. Drug that inhibits metabolism of phenytoin and increases plasma concentration of phenytoin include chloramphenicol. It's an antibiotic. Okay. It was previously very much popular drug to manage typhoid fever or enteric fever. Dicumarol, anticoagulant. Cimetidine, antipeptic ulcer drug. Sulfonamide, a type of antibiotic, especially useful in case of UTI. Isoniazid. This is an anti-TB drug, also called INH, isonicotinic acid hydrazide. Drugs that stimulates metabolism of phenytoin and decreases the plasma concentration of phenytoin. These are the carbamazepine, another anti-epileptic drug, and phenobarbital, another anti-epileptic drug, that will decrease the plasma concentration of phenytoin, stimulate the metabolism of phenytoin. And that's all about the pharmacology of the phenytoin. If you have any question, please feel free to ask me. Please share the information with your friends. Please support my channel. Please subscribe me. Have a nice, wonderful, and blessed day. Bye now.